How's it going, YouTube? So, recently I had cervical disc replacement surgery. I noticed online there's not a whole lot of videos of people describing early on post-surgery what they went through, what they felt, and a lot of the irritation and the things that they had to put up with, the difficulties. So, it was 2 days ago, I had cervical disc replacement surgery. As you can see from my beautiful little incision here, they've got that liquid stitched. There's no actual stitches there. I left the same day. Post-surgery, I stayed about 2 hours, had somebody there to drive me home, and it really wasn't that bad. I mean, obviously I don't remember the surgery, I was under general anesthesia, but I didn't feel too bad that day. They had me on Oxycontin, so I was feeling pretty good. Afterward, they gave me Vicaprofen and some carisoprodol. I guess it's a muscle relaxer for any kind of spasms I may be having. I can't take Vicodin because I can't have acetaminophen, so you probably, if you get this surgery, will have Vicodin as opposed to Vicaprofen. So the disc they use for my neck is called mobi-c, and if you look at the image here, it's actually an x-ray of my neck showing the mobi-c disc between C6 and C7 in my neck there. So mobi-c is a non-protruding disc. It shouldn't cause a whole lot of irritation down the road post-surgery. So right now, what I'm going through is obviously a lot of irritation from them moving my esophagus, my trachea, everything out of the way from the incision site so that they can work. And drinking irritates the throat. Eating any kind of food irritates the throat. My recommendation is have a good stock of soups, porridge, whatever else, soft foods that you can eat on hand. Any major motion, a lot of chewing, it can irritate just from pulling on the incision site. So yeah, my recommendation is have soups on hand. It's something you don't have to put a whole lot of effort into eating. Pretty much constantly feels like right around here in my throat that I've got something stuck in my throat. Hopefully this goes away pretty soon. Again, this is just 2 days post-surgery for me. I had been released the same day and been not taking my own advice, and I've been eating pretty solid foods, so I could be irritating my throat even more by doing that. So my recommendation is keep some liquid foods on hand. Other than eating and drinking, which is going to be your primary discomfort, sleeping is another problem. I find since the incision is on my right hand side that I have to sleep on my left side quite a bit, and even laying on my back I have to have the pillow propped up at a certain angle. I do have some tightness and a little bit of pain in the back of my neck, likely near the surgery site, but I'm not sure if that's just because of how I've had to sleep, how I have to hold my neck, or what, but hopefully that goes away further on along my recovery. I will be posting another video in about a week just to update on further recovery, how the throat feels, how the progress goes with all that. Most other activities, day-to-day activities, it's not difficult to do. Obviously, you're going to be told to avoid lifting anything over a certain weight. Lifting your arm over your head isn't too bad, but doing any kind of major motion, just be careful obviously when you're pulling on the skin. As far as range of motion for the head and neck, I'm really only limited by when I feel it pulling on the incision site. Obviously that's just me being cautious as to not tear open the wound. But it's a little bit stiff in the back of the neck here. That's about as far as I can go with the tightness I'm feeling in the neck. And that's about as far back as I can go. Speaking, I do get a little bit sore in the throat after talking for a certain amount of time. A certain length of time will make it a little bit more difficult to speak. So that's probably the three biggest factors is going to be obviously eating, sleeping, and speaking. And if you prepare ahead of time, you should be alright. Just know what to expect. It's not a lot of pain actually in the incision site. Obviously I'm taking the pain medication, but even when I wake up in the mornings and the pain meds have worn off, I don't have a significant amount of pain in the location of the incision. So that's good. Again, most of the pain I do feel in the back of the neck is just stiffness, and again that could be from how I have to sleep. So look forward to my next videos. If you watched the other ones first, I'll leave a little blurb in there to come back and check this one out so you can get me step by step. Yeah. Anyways, it's not that bad. Don't be too scared. If you're already in pain, trust me, it's an improvement. And I can only imagine through more and more days of recovery, it's only going to get better. So, get you a close-up real quick on my incision site. Just give a good look at that. You'll be able to shower the very next day. Just dab dry. Obviously you don't want to rub on it. Beyond that, that's pretty much it. So hope you liked the video, hope it was informative. If you have any other questions, please put it down in the comment block below. And one thing I missed, burping hurts like hell. Beyond that, yeah, just leave any questions in the comment block below and I'll answer them the best I can. Alright.